Management of gastrointestinal nematodes in goats. It is a common problem of goats under natural condition. And if we see the prevalence of the disease, it is widely prevalent in India, or we can say that it is widely prevalent in different agroclimatic zones and causing huge economic losses in terms of the reduction in growth rate, poor carcass quality, even in death. And from my side, as a parasitologist, I have seen that always the goats, or especially small ruminants like sheep and goat, they are always infected with gastrointestinal nematodes. And it is caused by a group of parasites, which is phylum Nematohelminthes. Why it is important? Important because it's mainly among the various parasites, the life cycle of this group of the parasite is very short. Every parasite of this group can complete their life cycle within 2 or 3 weeks. So that the infective stage of the diseases or parasites are always available on pasture. And we know that farmers, they are habitually the animals allowed to graze on the common grazing pasture so that they can easily ingesting the infective stage. This is the reason always goats are infected with gastrointestinal nematodes. And due to this problem, the farmer, they are always facing the economic losses in different manners. As we all aware that we are generally using the chemical drugs for controlling gastrointestinal nematodes under field condition. But despite of that, there are so many things if we are implemented, if we are adopted in a good animal husbandry practices, and I am sure that we can easily minimize the intensity of our infection and also minimize the economic losses caused by gastrointestinal nematodes. As I told you that it is caused by gastrointestinal nematode. The parasites which parasitize gastrointestinal tracts are the abomasum, the small intestine, large intestine. These are the group of the common parasite, which are widely prevalent in different agroclimatic zones. And especially this parasite, Haemonchus, Trichostomialis, Bunostomum are widely prevalent in different regions. But these two parasites, Nematodes, Osteotasia, these are mainly found in the animals of hilly region, like Kashmir, Himachal Pradesh, Uttarakhand, or we can say that if farmers rear animals beneath to the Himalayan region, they can easily pick up the infection of Osteotasia or Nematodes. So there are different type of parasite causing harmful effect on the host in different manner. If we see the parasites, some parasites, they are found in a small intestine, some are found in large intestine, and some are found in abomasum. This is the part of gastrointestinal tract. These are the photographs of some commonly found parasite. This is Haemonchus contortus. This is Cheversia. This one is Trichuris. This one is Osteotasia. This one is Bunostomum, and this one is Oesophagus. All are important. All are common parasite parasitizing goat in different regions. But if we see the prevalence, I have conducted a research trial from 2001 to 2012, and if you see after the 12 years, the maximum, the Haemonchus contortus, there is one parasite which parasitizes abomasum. The prevalence rate is very high, and you can see with all this Haemonchus parasitize the animals from January to December. Only difference is that the intensity of infection. Okay. However, the other parasite like Trichostomialis, Oesophagus, and others are less prevalent parasite which parasitize goat under field condition. Among all, the Haemonchus contortus is a common parasite which parasitize the abomasum of goats, including sheep. This is the adult parasite. When you recover from abomasum, it is slightly reddish in color. That's why we can say that It is red worm. Among all parasites which causes gastrointestinal nematodes, a disease condition, this parasite is considered as most pathogenic, most prevalent, most pathogenic, and widely distributed parasite. Reason is that the fecundity of the parasite is very high, so that the female worms, they are frequently laying eggs and easily contaminate the pastures, so that pastures are always infected with Haemonchus contortus larvae. Secondly, it is a blood-sucking nematode. Few nematodes or few gastrointestinal nematodes are blood-sucking capability, like Haemonchus, Osteotagia, Bunoestomum, etc. But among all, this parasite is considered as the most pathogenic parasite because a single worm can suck blood 0.05 ml per day. If any animal having the infection of 10,000, you can have 250 ml blood loss occur daily by only due to this parasite. When you recover this parasite, it is barber's look-like, barber's pole-like, so that we also, it is commonly called that barber's pole worm. It is a common. Among all the parasite, we can easily control the other parasite except Haemonchus contortus. The reason is that it is a commonly found parasite. It always parasitize the animals, so that farmers always do the animals. That's why, due to indiscriminate use of the drugs, drug resistance also occurred with this parasite. Haemonchus contortus showed resistant against most of the commonly used chemicals. So this is the another drawback. An important thing is that it causes huge economic losses. So what is the other options? How we can manage the infection of this parasite? How we can manage the problem of resistance under field conditions, so that we can produce better quality of meat, we can produce the better quality of wood with high body weight, etc., etc. If you see the parasite, why it is important in goat husbandry, what are the effects of the parasite? First is the anemia. There are so many parasites directly suck the blood from the host, causing anemia. And due to inflammation of gastrointestinal tracts, diarrhea may also occur. Due to diarrhea, there may be dehydration, weakness, reduction in growth, and it is important marker. It is important things in animal husbandry practices. We are mainly rear the goats for the production of meat purpose. If our animal gaining the more weight, then we can sell out at maximum cost. Then poor carcass quality, and last, if we are not treat the animals on right time, then death will also ensue due to this parasitic infection. That's why it is important. It is important to know that how the animal pick up the infection from the natural source. If we know how the animal takes the infection from the source, from the environment, then we can slightly modify our managemental practices or animal husbandry practices. Basically, if a single animal is infected with gastrointestinal nematode, they frequently discharge the eggs on pasture under the influence of environmental temperature and humidity. Embryonation starts. So that the infective larvae, which is third stage larvae, it looks like this. It is movable on grass blade, so they can easily move from one fecal pellet to the other corner of the grassland. These are always available on the pasture. When if a fresh animal or uninfected animal allowed to graze on the pasture contaminated with the infective stage, they can easily pick up the infection, and finally infection of gastrointestinal nematode is to be established under field condition. So here important thing, the major source of infection is the contaminated pasture. So this is the important thing, so that if we can manage the pasture land, then we can also able to reduce the intensity of infection in natural condition. These are some photographs. This is the diagrammatic representation. Egg passes in fishes, then L3 develop, then migration of larvae on grass plates, then ingested by the animals with herbage, excitement occurs, and then finally reaches to their citation, their site of predilection. Now, one thing is important: how farmers think that our animal is infected with gastrointestinal nematodes. These are the marker. Marker means if such type of signs exhibits by the animal, then we can think about the incidence of gastrointestinal nematodes. But it is not a thumb rule. These are the only sign of the gastrointestinal nematodes. But some signs they also exhibits by other parasitic infection. This is the animals having gastroenteritis, that is diarrhea, sometimes constipation, then emaciation. Then if animal is infected with blood-sucking parasite like Haemonchus, Monostomum, Giardia species, then due to heavy loss of blood, animal becomes anemic. In that condition, if anyone examine the exposed mucous membrane, the color of mucous membrane becomes change. It may be slight reddish in color or whitish in color. This type of animal, if the mucous membrane of any animal like this, it means the animal having high intensity of infection of gastrointestinal nematodes like Haemonchus. But this type of clinical signs also occurs in other helminth parasites. So on that basis, we can't say that it is a case of gastrointestinal nematodes. Due to heavy loss of blood, there may be hypoproteinemia, that is swelling at intermandibular region may also develop. There is one parasite, Oesophagostomy, which causes extensive nodulation on the wall of intestine. It is a common parasite. It also widely prevalent. If there is extensive nodulation on the wall of large intestine, such type of intestine is not suitable for market. So what happens if due to development of these things, the cell value of intestine is also reduced, and we know that there is a different kind of dish prepared, especially in hilly region, and this dish will prepare from the intestine of the sheep or goat, that is called batwa. Here in Uttarakhand, it is called batwa. Just we take the intestine and chop in small pieces and then cooked with masala and etc. and sell out. It is a very delicious dish. But if there is a nodule, then nobody is ready to purchase the intestine along with the nodule formation. The now question is, these are the marker. On that basis, we can suspect about the occurrence of the disease. But it needs confirmation whether these clinical signs exhibits by the animals are due to gastrointestinal nematodes or there is another causative agent. So first, it is a duty of all the farmers. It is first you confirm on these clinical signs we can suspect, and followed by the confirmation of the disease. And it is very easy. On the basis of clinical signs, we can suspect, and then fecal exam. Just you take 1 gram of fecal sample, send to the any veterinary laboratory, and they will give confirmatory diagnosis within few minutes. This is the egg of strong eye. This type of eggs are frequently discharged through feces by the infected animals, and anybody can identify this. It is oval in shape, and inside the egg cell there is a multi-cell stage. This is the character of strong eye. All strong eye, or we can say it is a common morphology of various kind of gastrointestinal nematodes. If we confirm, yes, fecal sample is positive for the strong eye legs, on that basis, we cannot say that whether the host is infected with pathogenic parasite like Haemonchus, Monostomum, or other parasite, because egg morphology is similar. So for confirmation, if we want to know whether the animal is infected with pathogenic parasite or moderate pathogenic parasite or non-pathogenic parasite, so finally, confirmatory diagnosis of gastrointestinal nematodosis is based on the culture of feces. It is a simple technique. Anybody can perform in laboratory. Just we culture the feces, and finally, following within 1 day from cultured feces, there is a development of infective larvae. The character of infective larvae varies from parasite to parasite. So on that basis, we can confirm. Our animal is infected with this kind of parasite. It will also helpful in selection of the drug. Suppose if I know that our animal is infected with gastrointestinal nematodes, but majority of the parasite belongs to Haemonchus parasite. In that condition, we can select the drugs effective against Haemonchus parasite. So that's why it is important task to the veterinarians or the farmers to know the parasitic dynamics of the gastrointestinal nematodes. It will help in management of the gastrointestinal nematodes under field condition. So this is the background of gastrointestinal nematodes. Now coming to the management of the disease, how we can manage under field condition. There are several methods, or we can say that there are several weapons can be used to control the gastrointestinal nematodes in goats. First is the chemical control, of course, by using the chemical drugs. Second is herbal or botanic. It is important thing. There are so many. What happens if any farmers try to examine the fecal sample and a veterinary doctor confirm this fecal sample is positive for a strangleworm worm, and they can easily prescribe the drugs? No, it doesn't mean that if a fecal sample having the egg of strangleworm worm, they need treatment. No, there are several things. If intensity of infection is very high, then we can eliminate the parasite. We want to eliminate the parasite within few days. In that condition, chemical drugs is required. But if there is a moderate infection or low degree of infection where the parasites are not capable to produce significant pathogenic effect, in that condition, we can minimize by providing the herbal plants or plant products which are abundant in nature. Third one is non-chemical control, managemental control, biological control, immunological control, nutritional control, genetic control. Among the managemental control, nutritional control are in hands of the farmer. By the adoption of these two techniques, the farmers can minimize the intensity of infection in a natural condition. So now I am going in detail. These are the different groups of drugs or anthelmintics which are effective against gastrointestinal nematodes: benzimidazole, imidazole, macrocyclic lactones, salicylate. Among benzimidazole compounds, we are generally using two compounds: benzimidazole, fenbendazole, and albendazole. It is effective drugs, but nowadays it has been observed that these drugs from this group are less effective due to emergence of resistance. But if a resistance problem is not there, then it is effective. We can use fenbendazole 10 mg per kg body weight, albendazole 10 mg per kg body weight through oral route. And one thing should kept in mind that fenbendazole is very safe during pregnancy. However, albendazole is not safe for pregnant animals. So avoid the use of albendazole in pregnant animals. However, imidazole, these two drugs are safe even in pregnancy, and levamisole, tetramizole. Levamisole is very common and easily available in Indian market. We can use 7.5 milligram per kg body weight orally. It is highly effective drugs. Then coming to the macrocyclic lactones, ivermectin and doramectin. Injectable formulation of ivermectin or doramectin is used as 0.2 milligram per kg body weight subcutaneously or 1 ml per 50 kg body weight. Among all the drugs, these are the different drugs available in market for controlling gastrointestinal nematodes in goat. But most important thing is that among all, the ivermectin is most effective, and the protection period of the drug is very high. If any goat having the infection of gastrointestinal nematodes, and if such kind of animal is treated with ivermectin, infection cannot be established before 2 months. It has been scientifically proven that the ivermectin, injectable formulation of ivermectin, is capable to protect the animals up to 2 months. That's why we can say that it is a drug of choice nowadays. Fourth group is salicylate. In this, there is one drug, closental, another is refoxanide. Closental used at 10 mg, refoxanide 7.5 milligram per kg, but with orally. But The drawback of the drugs of this group is that both clozental and repoxanide are highly effective against blood-sucking gastrointestinal nematodes like Haemongus, Bunostomum, etc. If animal having infection of other gastrointestinal nematodes like Oesophagoostomum, Trichostomalus, then the efficacy of this drug is very less. So this is important. If we know that our animal is infected with which kind of parasite, so on that basis we can select the accurate drugs, and it will be possible when we can give confirmatory diagnosis through fecal examination followed by culture of feces. Following culture of feces, we are able to confirm the disease, and then accordingly we can select the drug. So that drug of choice is ivermectin under field condition. It is highly effective drugs, and the protection period of the drug is very, very longer than the other group. So it is advised if even after the treatment with benzimidazole compounds, if the clinical signs are not disappeared from the animals, in that condition you may also treat the animals with ivermectin. Now coming to the second method, that is use of herbal or botanical plants. Or in this regard, several scientists have been exploited several herbal plants or their products having the enthelmintic capacity. These are the common plants. Bathwa, Babidang, Neem, it is very common. Coriander, it is very common. Karan, its distribution is limited. Ajwain, it is very common. Yak, plus, these are the common plants having enthelmintic efficacy. But if we see the scientific report that Trachyaspermum coptivum, that is Ajwain, showed 100% efficacy against gastrointestinal nematode, especially Haemongus contortus, where if we treat the animals with methanolic extract at dose rate of 0.25 mg per ml. And then beside this, you see that another plant, Aja diuretica indica. It is a unique plant having enthelmintic property, antibacterial property, molluscicidal activity. There are so many. I have also tested this plant. Fruit powder, simply we collect the leaves of neem, dry in set dry, and then make a powder and also feed the animals at 2.5 mg per ml. It showed 100% efficacy. Similarly, Pongamia glabra, currant. It is the first time I have used this plant against Haemongus contortus parasite. It also showed 100% efficacy against Haemongus contortus parasite in vitro trials. Next is the Chenopodium album Bathwa. It is also a rich source of vitamins and proteins. It also showed 100% efficacy against gastrointestinal nematodes like Haemongus contortus. Then beside this, Budia frondosa 56%, Trachyasperum 79%. Then you can see album Bathwa 3 gram per kg body weight directly. In a trial, it has been observed that if you allow to feed the animals with the Bathwa at 3 gram per kg body weight, it reduces 93% infection. It is sufficient. If any plant reduces the intensity of infection up to 93%, it is better. As per the guidelines of WABB, if any substances have showing efficacy more than 90%, it is considered as good enthelmintic. So we can use. It is very easy to use under field condition. There is one plant, Emboliya ribis. I have also tested this plant, which is locally called as Vibidang. We treated the animals at the dose rate of 10 gram per animals for 3 days. In sheep, it showed 100% efficacy, and goat 84% efficacy. We can also implement the use of these plants in feeding ration. In a trial, Nicotina tibicum and Aja diuretica indica 100%. At the dose of 2 plus 2 gram per kg body weight orally. Just you collect the leaves, dried it, make a powder, and mix in equal parts parts and treated at dose rate of 2 plus 2 gram per kg body weight, it showed 100% efficacy. So it is we can also use this plant and under field condition for controlling gastrointestinal nematodes. The only thing is that if animal having the infection, intensity of infection is very low, then there is no need to treat the animals with chemical drugs, because frequent use of the drugs may lead into the emergence of resistance. So in case of moderate infection or light infection, we can minimize the intensity of infection by incorporating these plant products in feeding ration. Coming to the managemental practices, housing, pasture management. Housing, good sanitation, feeding in trough. It avoids the fecal contamination because the egg passes through feces and contaminate, and then under the exposure of environmental condition, the houses can easily be contaminated with the infective larvae. Proper ventilation is important thing. Now, pasture management. It is important part for controlling gastrointestinal nematodes in field condition. As we know that the disease occurs in animals through ingestion of contaminated herbage. This is the major source. If we are aware, if we know how to manage the pasture, then we can easily reduce the intensity of infection. So these are the list of different kind of pasture management system: rotational grazing system, alternate grazing system, etc., etc. Rotational grazing system, it is nothing. Suppose there is one village. Suppose this is the village. There is a common pasture land. Just you divide the pasture land in different compartment or different parts. Allow the animals to graze on a part of pasture for shorter duration of time. Like suppose we divided the pasture in 4 types. First, we allow the animals to graze on pasture 1, and after 10 days, 15 days, 1 month, allow the animals to move on pasture 2, like pasture 3, then pasture 4. What happens after 1 month interval? This pasture left for 3 months, and after 3 months again the animals rotate on this pasture and start to graze. What happens if this pasture is contaminated? If on the first time, if animal discharge the eggs on pasture, and due to the lag phase of 3 months, this infective larvae exposed to environmental condition, and this is sufficient to cause the destruction of the larvae from the pasture, or it reduces the pasture contamination level. So by this way, we can minimize the intensity of infection. Alternate grazing system. Suppose there is a grazing land in a village, and several animals are there. First, we allow to graze the animals of different age group of the same species or different species. Suppose we want to allow goat to graze. First, we allow to adult goats on a pasture, because in adult animals, slide there is a development of immunity. So they are not highly susceptible. If they pick up the infection, but the disease does not occur in high form or severe form or acute form. However, due to lack of the immunity, if we allow kids or lambs to graze on pasture, they can easily ingesting the infective larvae, and due to unavailability, due to lack of immunity, the disease occurs in severe form. If there are options, first we allow cattle. Cattle is highly resistant, kar sakte hain, or we can say that the gastrointestinal nematodes is not a common problem in large ruminant. They ingesting the grasses containing the infective larvae. The maximum larvae they are ingested by the large animals, and it reduces the contamination level. Then we allow the adult animals, adult goat, and then allow the kids or lambs to graze on that pasture. So by this way, we can also control the intensity of contamination level by alternate grazing system. It is possible under field condition. it may be possible if there is a separate pasture land, then we can also implement the rotational grazing system. Alternate grazing system, it is very easy to implement in natural condition. Third is the mixed grazing system, allow to graze the animals of different species together, goat, sheep, cattle, buffalo, equine, etc., etc. What happens? Suppose we allow horses to graze on a pasture along with the sheep and goat. If pasture is contaminated with gastrointestinal nematodes of goat origin and ingested by horses, in that condition, infection cannot be established in equines. So by this way, it reduces the pasture contamination level. We can also adopt this technique. There is a zero grazing system. It is not possible in field condition. It is a system in which the animals are raised in confined dry lot. We are not providing the green grasses or green herbage. So that if we always provide the dry lots, they are free from the infective larvae. So by this way, infection cannot be established in the host. Resting the pasture, it is important. It has been observed that if the pasture land is left to expose for 2 months in summer and 6 months in winter, due to unavailability of the host and exposure against the environmental temperature, these two factors reduces the intensity of infection on pasture. Or we can say that due to unavailability of the host and the environmental condition, it causes destruction of the larvae and leads into the reduction in contamination level. It may be possible if there are so many lands in a village, then we can adopt this technique, this system. If there is a limitation to graze on the pasture, and then we cannot adopt this technique. Then pasture height, it is important thing. We know that the sheep is a carpet grazer. The concentration of larvae on grass blade also vary from side to side. During daytime, all the larvae settle down at bottom of the grass root. However, during evening and morning, larvae equally distributed on the grass height. Should we graze on tall or longer? 10 centimeter up to 10 centimeter grasses is allowed to fed by the animals, and up to 10 centimeter, there is a maximum concentration of infective larvae, and above that, there is a less concentration of infective larvae. So always try the animals to graze on the upper part of the herb. Especially, and this is the important things. Animal farmers are not aware of which time is suitable for grazing of the animals. It is better during daytime. What happens during daytime? The larvae concentration decreases from the upper layer to bottom layer. If we allow the animals to graze during daytime, they graze on the upper part of the grasses and ingesting less number of infective larvae. It reduces the infection rate. Then stocking rate, it is important. High stocking density on pasture increases the pasture contamination level or pasture burden. So always try to minimize the less number of animals allowed to graze on a pasture for shorter duration of time. High density rate increases the incidence of diseases. Less density rate decreases the incidence of infection. Among all, this is the better way. Dose and move grazing system. What happens in this managemental system? First, we treat all the animals. Suppose a farmer having 50 animals, and they are interested to permit the animals to graze on a pasture. Before allowing the animals to graze on a fresh pasture, it is better to treat all the animals with suitable drug or highly effective drugs like ivermectin. First, we treat the animals with effective drugs. What happens? All animal becomes free from the infection, and then transfer on fresh pasture for grazing. What happens? The animals, they also discharge the fecal sample on this pasture, but the fecal sample do not having the eggs of the nematode, or if having, the number or concentration is very less. So what happens? This pasture is not infected, cannot be infected with infective larvae of gastrointestinal nematodes. This dose and moves among all the pasture management. This is most effective grazing system, and it is very easy to perform. It is very easy to adopt for better goat husbandry. It is a duty of all the goat farmers. If there is a separate farm, separate land for grazing, first we treat and then after allow to graze. Then grazing time, I have already told you that late morning to early evening is suitable time. Suitable time to allow the animals to graze on the clean pasture. Then alternate forage, as I mentioned that there are so many plants having the anthelmintic capacity, anthelmintic activity. So such kind of plant products or like leaves, seeds, etc., can also allow to feed the animals. Now biological control is important, but it is not feasible under field condition. And second thing is that so many scientists they have tested that this fungi has capability to eliminate the parasite from the animal host, but it is not commercially available in Indian market. Also, both this Oligospora Durintunia flagrana. These are the fungal spores. Fungal spores allow to feed the animals along with the feeding material. It is a non-pathogenic. It is directly passes through the intestine that is feces. When the animal discharge the feces, if they are infected with gastrointestinal nematodes, fecal sample containing eggs, and this fungal spore also passes through feces. So what happens when it comes in environment? Fungal spore germinates and mycelium develops. The mycelium traps the developing larva, and it reduces dissemination of the infective larvae from fecal pad to other parts of the grazing land. Then immunological control, as I told you that there are so many parasites causing gastrointestinal nematodes in field condition. Among all, Haemonchus contortus is most pathogenic, and this parasite is globally prevalent. And in every country, this is the parasite which causes huge economic losses in sheep and goat husbandry. So considering the importance of this parasite, a team of scientists has developed a commercialized vaccine with the name of Barbervax in USA, but it is not marketed in India. This is the Barbervax 1 ml intramuscular under the skin, 5 doses. It reduces the 95% infection rate. It is a good thing, but it is not possible in field condition, and it is not possible in India. As we know that the parasite causing different kind of effects. Some parasite directly cause the anemia or directly absorb the blood, and some parasite cause the atrophy of the intestine. They are due to heavy loss of blood, the animal becomes deficient of blood, and or we can say there is a relaxation in immunity, or also make them the animals susceptible for several other diseases. But if we provide the ration rich in protein, minerals, vitamin, or tannin, and tannin, it will also help in the controlling of the gastrointestinal nematodes. Protein-rich diet or protein is responsible for the production of antiparasitic immunoglobulin, that is IgA. So protein-rich diet is important. Help in urea molasses. Urea molasses, it increases the microbial protein synthesis. So we can also use urea molasses blockade. It is available in, I think it is available in every state. Urea molasses blockade by the private organization or by the government organization. We can also use. You can see here, this is urea molasses block, and allow to leak the animals for some time, and then after you remove the animals. By this way, we can incorporate. Then what happens if we provide the ration or feed rich in urea protein? It reduces So due to development of IgA and high protein concentration, it decreases the establishment of infective larvae introduced in the animals while grazing on the contaminated pasture. And it increases the expulsion of the adult parasite. Okay, if it reduces the infective larvae, the parasite do not attain the sexual maturity. In that condition, there is a decrease in fecal egg count. Then it reduces or it increases the body weight or growth or the production parameter. Finally, it reduces the frequency of anthelmintic treatment. Only by incorporating protein, urea, we can minimize the intensity of infection, and we can also minimize the indiscriminate use of anthelmintic treatment, which leads into the anthelmintic resistance. Minerals, it is important. We know that blood for to meet out the blood losses, copper, iron, cobalt, phosphorus. These are the important minerals which helps in the blood formation. It has been tested so that minerals, there are so many mineral mixture available in the market. It is a customary of all the goat farmers allowed to feed the animals regularly. In goats, 10 gram mineral mixture like agrimin for 10 gram or 20 gram morning, evening, it is sufficient. Just you allow the animals to feed mineral supplement. Then, as it has been scientifically established that there are so many plants having the anthelmintic efficacy. And anthelmintic efficacy, any plants having showed the anthelmintic efficacy due to high tannin content, saponin, etc. So plants having high tannin is helpful in reducing the intensity of infection. Like neem, there are high tannin, high saponin. It is very good plant. Nicotina, tannin, high tannin concentration. These are the plants we can introduce in feeding system. Besides this, there is most important and suitable way through which we can minimize the intensity of infection. That is the introduction of genetically resistant breed. There are so many breeds like East African goats, Santa Ynez, a small East African. These are the goat breeds which are highly resistant to intestinal nematodes like Humongous contortus, as we know that it is most pathogenic parasite. If we are able to introduce these animals in India, I am sure that the intensity of Humongous contortus infection may reduces, but it depends upon the environmental condition, whether the environmental condition of India is suitable for rearing of these goat breeds or not. It is a matter of time, but at least by crossbreeding program we can develop a crossbreed, and it has also been observed that crossbreed animals are less susceptible to exotic breeds. There are so many research have been carried out. I think in Hisar, there are so many, even in Bengal, there are so many reports which depict that the crossbreeds are slightly resistant to Humongous contortus infection as native breeds. So these are the different methods through which we can minimize the intensity of infection, that is gastrointestinal nematodes under field condition. And finally, we say that it is a common problem of goat under field condition, and it is a disease which are widely prevalent in different climatic zones, and goats are always infected with this parasite and causing a huge economic losses. To mitigate this problem, that rotational use of anthelmintic treatment should be practiced, and always try to use the effective drugs, whether they are effective or not, and also try to use the drugs as per the parasite dynamics, whether the parasite having mono infection, single infection, or mixed infection, which drug is better, which drug is not. It will be possible where if any farmer or if any veterinary professionals are capable to say that these are the parasite dynamics, it will help in the selection of the drugs. And always provide the feed Along with the green garbage, always provide the mineral, protein, vitamin-rich diet so that the immunity can be build up. And plant-rich tannin should allow to feed the animals. If not possible, then simply there is every kitchen garbage material having some degree of enthalmatic activity. It may be onion, it may be garlic, it may be ginger, anything you can use, neem, bathwa, etc., etc. These are the waste product. We are using bathwa regularly, but we select and some part is to be discarded. So this part can allow to feed the animals. By this way, we can minimize the disease condition, that is gastrointestinal nematodes in field condition. Thank you very much.